The National Agency for Food and Drug Administration and Control, NAFDAC, has alerted the public and healthcare professionals about 4 tainted cough syrups which have been responsible for the death of 66 children in Gambia during the last 3 months. The Director General of NAFDAC, Professor Mojisola Adeyeye, while speaking to newsmen in Abuja, says the producer of the syrup have been unable to give the World Health Organization guarantees on the quality and safety of the products. Professor Adeyeye urged all stakeholders and the general public to desist from using the products as they are dangerous to the health of users.
On 5th of October 2022, the World Health Organization issued a global alert for 4 cough syrups, warning that they could be linked to acute kidney injuries and children's death in July, August, and September in the Gambia. Interviews conducted on bereaved parents in the Gambia by health authorities and law enforcement agencies revealed how their children are not able to pass urine after being given the syrups. As their conditions worsened, efforts to save their lives were fruitless, which has resulted in the death of over 66 children. It is pertinent to know that toxic effects of this contamination in cough syrup include abdominal pain, vomiting, diarrhea, inability to pass urine, headache, altered mental state, and acute kidney injury, which may lead to death, and indeed has led to many deaths in the Gambia. We have put appropriate measures in place to prevent entry of these spurious products from the various ports of entry and have activated our internal surveillance mechanisms to mop up these products from the supply chain pipeline if they ever are found in our own country. These suspected medical products are promethazine oral solution, cofzimalaine baby cough syrup, Markov's baby cough syrup, and Magrib N cold syrup. These products were manufactured by an Indian company, Maiden Pharmaceuticals, which had failed to provide guarantees about their safety. National Agency for Food and Drugs Administration and Control is issuing through this medium to further notify healthcare providers and awaken the consciousness of the public on these 4 substandard products identified in the Gambia and reported to WHO in September 2022. According to WHO report, laboratory analysis of samples of the 4 products confirms that they contain unacceptable amounts of diethylene glycol and ethylene glycol as contaminants. Diethylene glycol and ethylene glycol are restricted chemicals which are toxic to humans when consumed and can prove fatal, and indeed has proven fatal. These products are not registered by NAFDAC, therefore should not be in circulation. To date, these 4 products have been identified in the Gambia, but may have been distributed through informal markets to other countries or regions. That is why we have heightened our vigilance. NAFDAC implores importers, distributors, retailers, and consumers and stakeholders to exercise caution and vigilance within the supply chain to avoid the importation, distribution, sale, and use of the substandard cough syrups. All medical products must be obtained from authorized, licensed pharmacists or suppliers. The product's authenticity and physical condition should be carefully checked. Members of the public in possession of the above listed products are advised to discontinue use or sale and submit stock to the nearest NAFDAC office.